physician care, and I'm here to talk to you today about direct primary care. Again, my name is Dr. Sharyl Truty, owner of Balanced Physician Care, and a lot of people have questions about direct primary care. I've been in practice now for over 17 years, and we started this practice here in the Jacksonville area, balanced physician care based on the direct primary care model. So today we're going to talk about what is it and how it might be a good healthcare solution for you, and talk about a few other solutions that work well in combination with direct primary care. So, basically direct primary care is a new type of healthcare model that has emerged over the last 5 to 6 years. It's really come into its own. When I started my own practice about 6 years ago, there was probably only about 600 practices across the country that did direct primary care. But now you can see that amount is growing throughout the country as the popularity of this type of practice begins to grow. It's definitely on the minds of our Florida legislature, and it has been well accepted by the Florida legislature as another healthcare option. In January of 2018, they passed legislation stating that it was not insurance, which was a very important milestone for us to qualify us as a legitimate healthcare membership model that's unique. And they've also passed other legislative things that have made it more friendly for business owners to be able to offer this to their employees. And state by state across the country, you're seeing direct primary care grow. So what exactly is direct primary care? A lot of people talk about concierge medicine and ask me, well, it's concierge medicine, right? And that's not, really true. We distinguish ourselves different from concierge medicine in the sense that we do charge a periodic fee in exchange for services, but we do not bill any third parties on a regular basis. And that's often where concierge practices and our type of practice diverge, is that concierge practices will often bill insurance or other third parties. But for direct primary care, it's just about the patient and the practice, and it's just an agreement between them doing a different type of payment model, and no one else is billed. So why is this growing? I mean, why are you seeing more people take a look at that as an option for their health care? Well, we think that there's three main reasons that we're seeing it grow, and reasons that may resonate with you yourself as someone who's looking into this. First of all, there's a huge emergence of the self-pay market now in healthcare. We think that direct primary care improves quality and provides a quality product above and beyond what traditional healthcare does. And being a part of the practice actually can reduce costs for a lot of people. So, what type of healthcare are most of us really looking at today? I know our politicians, for the last few months have been promising that they're going to have the answers, but in reality, what is most of us are facing out in the market? Well, according to the CDC back in 2016, and I would imagine that this has grown, that 40% of adults in 2016, if they have insurance, they have a high deductible plan. And what that means is that most people, 40% of people, are paying cash for their health care because oftentimes you're not meeting that deductible because it's so high. And if you couple that with 10% of people who are uninsured, that's 50% of people now who are paying cash for their health care, especially a lot of their basic primary care and urgent care needs. So direct primary care says, okay, if there is this new direct-to-consumer type of healthcare, can healthcare be different, and should it be different? And so, what is your typical healthcare experience like? Well, for most of us, if you go to a traditional office, right, you don't get a visit with the doctor right away. I mean, you're going to have to wait 3 weeks, 4 weeks, sometimes even months to get in to see your own personal primary care doctor, who knows you well. If there's an urgent issue comes up, you're often told to go to an urgent care or go to an ER. You don't get a chance to see your own physician. And then when you're there, you often wait, 45 minutes, sometimes an hour to actually see the doctor or your provider. And then once you're there, you probably only spend about 10 minutes, because that's all that, healthcare and the way it's designed is allowing providers. And so what does that leave? That leaves time for a few prescriptions, referrals, not much time for discussion of what's going on, what your options are, and what might be right for you. And so, that really doesn't leave for good medicine. So obviously this type of practice, this membership-based practice, is growing, because I think there's a real call for more personalized medicine. In this type of a practice, we really focus on getting to know the patient really well and spending the time that you need. If we can't spend it immediately at this visit, we're going to schedule you the next day or do a telephone call the next day. But we really are going to be able to try to make sure that we spend as much time as you need to go over things. And we make sure that you understand what your choices are, in light of your personal situation and what works best for you. So we're going to go over all those options, and we get to know you really well. And why are we able to do this? Is because this type of a practice only has a limited amount of patients. I mean, most physicians in a traditional practice have 1,000, 2,000 patients that you're seeing. And in our type of practice, we're only going to have, 200 to 400 patients. Now, concierge, they may only have 50 or 100, but obviously their pricing, is much larger for that. So we find that middle ground of a very affordable monthly price, but keeping our patient population small so that we get to know you better. And that's really what makes direct primary care stand out, is that there are studies that show it improves your quality of care. So there are studies that show that people who are a part of a direct primary care practice as patients, they have 66% less specialty visits, 65% less ER visits, 35% less hospitalizations, and 82% less surgeries. And that reflects that this type of practice really does lead to better outcomes, improved quality for you and for your loved ones. And again, this is because of that relationship is really nurtured in this type of practice. So, as we're talking about reasons why it's growing, there's obviously this demand for quality from the consumer. And, besides just the quality and the relationship, we also strive to make the practice convenient for you, so that we have been using telehealth and telemedicine way before the pandemic started. And so we really utilize that so that patients don't have to come into the office. There's a lot of things that we can do over the phone or over telehealth to manage people's issues without making them come in. And that way we give you access everywhere. So if you're visiting your family in California, or you're visiting a cousin in New York for a weekend, or you're on a business trip there, we can go with you. So you can call us, email us, if something comes up, and we're able to take care of you remotely and go wherever you are, so you don't have to run around and scramble to find an urgent care or something like that. And then we really work at trying to help coordinate and help you work through the healthcare system, so that, if we send a referral somewhere and there's some kind of issue, we're going to really work with our staff to make sure that, your things are resolved as needed. And then we provide cost efficiency, because we've eliminated the middleman. There is a middleman, and insurance is a little bit of a middleman in the sense that it, you know, creates, another player in the market. And by eliminating that payer that's making money off of this sort of type of practice, we're able to provide cost savings, on to you, the patients. And so we're always looking for ways to save you money. And that may be with prescriptions, it might be with labs, it might be with x-rays and MRIs. And so that brings me to the third reason why it's growing again is this cost efficiency, because we are, spending the time in the office when there's a prescription to discuss pricing. We look it up on, a prescription program like GoodRx. Where's the cheapest place that we can find you the prescriptions? We also offer prescriptions in our office to provide patients discounts as well. If we can find them cheaper than what is available out in the market. And then we really go around and find great self-pay pricing for x-rays and MRIs and labs so that you can kind of be able to balance, okay, I want to go to this location, which is convenient for me for this price. So there's that price transparency. So you're not just walking in with an order and having no idea at all what you're going to be billed or what your responsibility might be. You know that ahead of time in this sort of a model with the membership and the cash pay pricing. So again, I love this slide. It summarizes everything. Direct primary care is about providing quality, number one, but reducing your costs, making it convenient, and eliminating, excess in the healthcare system. So, obviously, if this has sort of grabbed your attention, our practice is called Balanced Physician Care. And we have two types of membership availability here at our practice. This is a kind of a great listing of what is included in our membership. So, we obviously provide 24/7 unlimited access. We make sure that patients have the ability to have same day or next day visits. We always leave 1 or 2 slots open in the schedule so that we can make sure that patients have that same day or next day access for urgent issues. All of our procedures that I'm able to do as a provider are included in that monthly membership cost. And so I'm able to do injections, I'm able to do skin biopsies, and you come in, you're paying your monthly fee and you need any of those procedures, you just come in, and the only extra cost might be the cost of the medication that we're using, but otherwise that's all included. Again, online visits, direct telephone access to me as your provider after hours. If you have an urgency and after hours or evenings, me or my nurse practitioner who I work with, we're going to be there and available to work you through that. And even see you in the office if it's an urgent issue that we need to do so. We do the whole breadth of primary care, pediatrics. We do a lot of comprehensive wellness stuff. We do sports physicals, camp physicals, and in my practice, in our premier membership level, I do hormone replacement therapy, and I do a lot of holistic medicine. I've been trained with Dr. Andrew Weil, and we integrate that. On our practice, we also have IV therapy, diet and nutrition counseling, and acupuncture. For our premier members, we include a basic set of wellness labs. For our basic members, we offer, again, really great pricing on labs for anything that you may need. And again, there's a whole list here of all the different things that we do. So these are, again, our 2 membership levels. We have a basic care and a premier care. And the basic care My patients work with a nurse practitioner, Arlene, who's a family practice nurse practitioner. And basically, you pay it's $69 a month for an adult, and it's $49 for a child. And we just have a visit fee when you come in for a visit. But otherwise than that, again, everything that we just talked about is included in that membership. And it's really meant to be the standard direct primary care, basic family practice type of membership available to patients. And so I think it is really a great affordable option for people who are struggling, in this healthcare environment to find some type of care and coverage. It's a flat monthly fee. You know exactly what you're paying for, and then you get all this package of services, as you need them. And I know for some people, they say, well, I don't go to the doctor much, but what usually happens in medicine is you don't need something, and then you need a whole bunch of services all at once. And, this is a way of knowing you have someone there for you in your back pocket. You have someone to ask questions. You can get your preventative medicine done. And it's all under one flat umbrella, flat fee. And we've made it this way, and again, designed for people who may only come into the office, a few times a year. Then we have our Premier Care membership, which that obviously is for people who are really looking for a very holistic approach, or for people who just kind of want to have everything all together at once, no visit fees, everything's just included, and they just basically pay one fee. So with the Premier Care, there's no visit fees, and we also include with that a wellness panel every year, which includes CBC, lipid panel, kidney function, thyroid function screen. So every year we offer that for our members. And, it also includes all the services that I'm able to do. Again, as I mentioned before, hormone replacement therapy, sports medicine consultations, and functional medicine and holistic medicine visits. I also do acupuncture for anyone who signs up for Premier Care, I offer 3 free visits when you sign up. And then after that, we charge a minimal amount for a regular acupuncture visit, only $50 a visit after that. We do have an enrollment fee that we ask you to pay when you first join. That just covers our administrative costs. But again, I think it's a great deal. So how does this work with, families? We have a lot of people who are looking for memberships for their families. And so again, we have family plans because we are family practice office. And so we have a basic membership family plan, as you can see here. 2 adults, $69 a month. The first child, $49 a month. And then the second child is only $13 a month. And then we have a family plan for those looking for more the Premier membership. The family is $309 per month. And parent and child alone, single parent and a child, is $198 a month. And certainly if you have any more questions, please, feel free to reach out for our office. So that talks about direct primary care and really what it can do to provide you with that coverage. Most of us as primary care physicians can take care of 85% of your needs. Those are where the averages, show us for those that have been, trained in family practice. But obviously there's also times when you need to see specialists, when you have to go to the ER based on, medical issues. And what we have found that's unique in the marketplace is a health share. There are a lot of different health shares out there. Maybe you've heard of them, maybe you haven't. So I'm going to talk a little bit about what a health share is here coming up in the next couple of slides. But I wanted to point out that one that has really advocated for us as primary care and direct primary care practitioners and sees what we're trying to do in the marketplace, what we're trying to do for quality, is Sedera. And they've really designed a great health share. It's secular in nature, and to really wrap around what we're doing as direct primary care to fill in the gaps with what we're not able to do. And what they do is that they give you discounts if you belong to our type of membership, a direct primary care membership. Your monthly share amounts are less when you're a part of it, because they recognize the savings that we're really trying to do on their behalf. So how does this health share thing work? So basically, it's a medical cost sharing, and it's an innovative way for managing costs. And basically, all these people are part of this same group, and the members share each other burdens and pay for each other's price, pay for each other's bills. So you join as an individual or as a family. You can do it as an individual. There are even employer policies. And then you contribute a monthly sharing amount. And that's similar to a monthly premium amount. You get to, and you can decide what level or what tier that you might do. And then when you have a medical need, whatever it might be, let's say a knee strain of some kind, then you pay for that problem. You pay for your shareable amount, unshareable amount. And then once you reach that amount that you decided when you first joined the health share, then everything after that, the health share will pay for, and you submit the rest of the bills to the community. And then the community has collected and kept these funds, and they then shares these funds with the member to meet their needs. So that's, kind of what it is. Now, it's not health insurance, but again, it's this community that is paying for each other's bills. And these communities have grown tremendously. So they span the entire country. And so regardless, you may be in Florida, but your community may span the entire country. And if you get injured in California, it's still okay. It's still part of that community. So it is travels with you wherever you go. So this is a great example. It's hard. It gives into the nitty gritty about how it actually works. So as an example, let's say you pay for the health share that has a $1,500 unshareable amount. It's kind of like a deductible with health insurance. And so, but it's not like a deductible in the sense of a deductible goes year per year. What health shares do is it goes per event. And so you can see here, there's 5 different events examples. And, I like to look at, the broken arm, you fall and you break an arm and you go, you go to emergency facility. So we know that you have a pretty significant break. I know that I'm not going to be able to set your bone. And it happens, at a time when there's no outpatient radiology open. So you've got to go, to an emergency room, because it's a significant break. And you go there and, the ER visit is $2,000, and, I think that's a great price. I mean, I'd love to see an ER visit just be $2,000, but let's say it is. And the x-rays are only $250. So you've racked up a bill of $2,250. Well, then after you go to the ER, you have to go see the specialist to get the bone looked at and maybe casted. And, the office visit might be another $200 for that. I'll be honest with you, I think most specialists would be $300 or $400, and maybe you get a prescription. So you can see here that the total cost can easily, run up. And so once for this event, you've reached your sharing amount, you've paid your $1,500, but the community will then from there on pay the rest of your bills. So if you have 10 more office visits that you have, you've met your unshareable amount, and after that, the health share will pay the rest of the bills as they relate to this event. And so, broken arm is example of an urgent issue, but obviously in the example of chronic issues, again, you've got that initial unshareable amount, but after that, for chronic issues, the community will continue to pay your bills after that. So I think this is a really great, unique way, because for most of us, we're dealing usually with one problem at a time, as opposed to resetting every year. You have the same problem, but now every year you've got to meet this deductible. Most of us just have a few issues, and this health share, once you've paid your initial shareable amount, covers you. And so you can see that they cover pregnancies, and you can see, that they cover, things as big as a heart attack. So again, this is kind of another diagram of how it works. A lot of times with Sedera, if you've got a big medical issue, they'll sometimes ask you to see a second opinion, and they also negotiate on your behalf. If you do have to go to ER, they help negotiate the price of your billing down, because it's in their best interest, obviously, to decrease the bills. So this is what the Sedera membership contributions are if you belong to a direct primary care practice like ours. So, as you can see, there's many different levels. There's $500, $1,000, $2,000, $5,000, unshareable amount levels. So you can pick, for you and your family, what works best for you. Obviously, as the unshareable amount goes up, your contribution on a monthly basis is less. And for most of us, if we've looked at healthcare premiums for 2021, for most of them, they're quite a bit more than this is. And so again, here you have, this great kind of combination where we take care of your direct primary care and try to manage most of your cash pay costs down to a minimal level. For us, you have a flat, affordable monthly fee, and then you pay, a monthly fee for this extra wraparound coverage that covers you. And you really have a very competitive program, competitive against, what you're paying now for health insurance out in the market. And so I think that this is a real solution that people need to hear about and contemplate to see if this is right for their families, because the premiums are just getting so high for insurance. And if people are not using them, they end up, spending all this money for something that they may not use. And these health shares are really a unique solution to that. So I think it's definitely worth looking into. So again, this is our practice, and this is what we do. I've been in practice for over 17 years. I'm certified in family practice, sports medicine, and integrative medicine, and I've been doing acupuncture for over 16 years. If what we do here has sparked your interest, we'd love to, talk to you. So, give us a call, check us out, our website. We have a lot of this information there. give us a call. Darren, our membership director, be happy to talk to you a little bit more. You can also send us an email, and we'd happy to send up a free meet and greet. We often do that just to answer questions, let you know the ins and outs, because we really believe that we are providing this quality of care, and we go over the ins and outs and make sure that this is, the right thing for you. And again, we can always talk about the health share and how it may fit in as well. So thank you very much for joining us today, at this presentation about direct primary care for the individual. And I just want to check to see if anybody has any questions. I'm just going to take a quick look at the chat box. If anybody has any questions, please feel free to send them through. So I don't see any questions. So again, thank you very much for, having us here and joining with us today. And again, please feel free to reach out by phone, email, or anything, and give us a call and see if direct primary care can really be good for you and for your family. Have a good evening.